The following is brought to you by CentrePointe Counseling, providing licensed Christian counselors to Maryland, D.C., and Virginia. Emily Leibelsberger and Aaron Stein are licensed professional counselors, bringing you practical tools and techniques for coping with emotions during COVID-19. The following is not intended to replace therapy. To learn more about CentrePointe Counseling and available counseling services, visit www.hopethatheals.org. Hi, I'm Emily Leibelsberger, and I'm here today with Aaron Stein. Hi, Aaron.
Hi.
Aaron and I are both licensed professional counselors with CentrePointe Counseling, and today we're talking about coping with our emotions during this unprecedented time of COVID-19. And to start off our series, we're going to be talking about grief today. So, Aaron, what is meant? Why are we talking about grief during this COVID-19? What exactly are we grieving?
I think we're grieving a lot of things. A lot of people are experiencing just a real loss of routine during this time.
Yeah.
A lot of people have lost their jobs. The
Yeah.
unemployment rate has skyrocketed. A lot of people
Mhm.
are scared financially. They're scared for their health. They're scared for their loved ones. So there's a lot of grief going on. An anticipatory kind of grief for some things. We're anticipating things going wrong or anticipating
Mm,
things not going to be this. They're not going to be the same again.
mhm.
So
That's a
we're
really good point. So we're not just grieving what has already happened, which is sort of how we might typically think of grief, grieving something that happened in the past. We're grieving something that's currently happening, as well as something that's happened in the past with the loss of routine, but anticipating what could happen in kind of a worst case scenario.
hmm
So how do we deal with that grief and experience that grief for what has happened, what is currently happening, and what might happen? How do we do that in a healthy way?
That's a great question. I think first of all, sometimes we're going to do it in a healthy way, and sometimes we're not, and that's
And
okay.
that's okay. Yeah,
I think it's
absolutely.
even therapists, we're
Hmm.
not perfect at this.
Yeah,
No
yeah,
one's perfect at what they're feeling. I think really a
yeah,
lot of this, and I think my hope with this um, video that we're creating for people
yeah,
is just for people to be encouraged and to know that what they're feeling is normal,
yeah,
and that we can accept what we're feeling. What we're feeling is valid. And I think a lot of
yeah.
times we say, well, I shouldn't feel that, or I shouldn't experience that, or I should be grateful. I should be grateful for all I have right now. I should be grateful I have a job, and I should be grateful we're healthy. And yes, gratefulness is very important, but it's also
Hmm.
we're allowed to feel what we're feeling that day. And
So
it's
balancing
okay.
that, like
Mhm.
balancing that gratefulness with still an awareness and an acceptance of maybe I'm not okay right now, and not being okay is okay. Grief actually has stages to it. Do you want to just summarize the stages of grief?
Sure. I didn't come up with this, but a person, Elizabeth Kubler-Ross, came up with this in her 1969 book called in Death and Dying. And she looked at terminally ill patients and kind of the process they went through in terms of accepting that they were passing away. And she noticed that there were 5 stages. And so those stages, a lot of people have heard of these already, but they're denial, anger, bargaining, depression, and acceptance. And there was a
Mhm.
6th stage that was actually added after she passed away by someone who worked with her named David Kessler. And he came up with the final stage as finding meaning. And I think that one
Mhm.
is really important during this time as well, is how do we not just accept things, but create meaning in it? I don't know if
Absolutely.
any of you ever read the book Viktor Frankl, who was someone who was during the Holocaust, who was in a prison camp. And he talked a
Mhm.
lot about man making meaning of things. And we need to make meaning in these situations in order to come to a place of really being able to move forward. So I think that's important
Right.
too.
Absolutely. So those are what we're going to be talking about in this little mini series that we're developing. We're going to talk about the stages of grief as they apply to this COVID-19 situation and as they apply to the emotions that you are or have experienced or that your loved ones are also maybe experiencing. So we're looking forward to that. Thank you so much for joining us today, and we look forward to
seeing you soon as we process through the stages of grief through COVID-19.
We hope you've enjoyed this presentation brought to you by CentrePointe Counseling. CentrePointe Counseling offers a mercy grant program called the Samaritan Fund, helping people access care from our counselors. This program is made possible by donations from supporters like you. To learn more about CentrePointe Counseling and the Samaritan Fund, please visit us at www.hopethatheals.org.